Hi, it's Mary Beth Simone. In this episode, I want to walk you through the critical first steps when a health crisis strikes. When you suddenly find yourself making decisions for someone else under enormous pressure, I'll share what helped me and what I wish we had in place, and the simple actions that you can take that will make a world of difference. So, initially, when the crisis happens, it may be like what happened with me. I received a phone call that my cousin had a stroke, and everything changed at that moment. After asking some initial questions, my response was that this was going to get very complicated very quickly. Here's what immediately mattered: being granted healthcare power of attorney so that I could make medical decisions for her and speak on her behalf, a basic understanding of her wishes. And that happened through informal conversations that we were able to have, as well as the conversations that she had with her attorney eventually in preparation of getting her will and estate plan in place. And those decisions were the guide to future decisions that would need to be made. And without those, we would have been stuck in legal red tape right when timing was critical. Next was managing the practical chaos. In addition to medical care, there were practical aspects that needed to be thought about. Things like paying the bills, the mortgage, the utilities, cable, accessing bank accounts. Power of attorney is crucial here. No one wants to talk with you unless you are authorized. Managing work leave for this person and disability benefits, 401k contributions. The same thing, you have to be authorized. And then the hardest part is you're doing all of this while you're juggling your own life. That's why preparation matters. You fall to the level of your planning rather than rising to the occasion. What I wish we had in place looking back, these are some of the things that would have made it easier. A clear and written healthcare directive to know exactly what she wanted. A simple list of her accounts and bills to avoid scrambling around last minute, especially with a brain injury. Conversations with family ahead of time to reduce any chaos and conflict that happened. These are the things that are required in order to be able to provide care, because you're not just handling paperwork. You are doing everything that you can to protect that person's dignity during very challenging circumstances. So my biggest advice before you find yourself in this situation, get your power of attorney and healthcare directives in place now. And not just you. If there are people close to you who need that encouragement, that's what we're also focused on in this video series, is getting those around us prepared. Encourage them to get their power of attorney and healthcare directives in place. Make sure someone you trust knows where they are. If you are going to be the person who is the trusted individual for someone else, make sure you're keeping open lines of communication so that you know where everything is. Talk to your family. Even short conversations help. Anytime that you get the opportunity, during a phone conversation, when you see each other for the holidays, whenever, a couple of minutes matters. Because we don't get to choose when the crisis is going to hit, but we do get to choose how prepared we are for that crisis. And if this episode speaks to you, please subscribe and share it. You never know who you might be helping with this information. And next time, we'll dive into creating an estate plan in the middle of a crisis. Thank you for watching, and I'm glad you're here. Take care.